Good afternoon and welcome to Facebook Live. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thanks for joining me today and or at some other point in time. Today is September 1st, 2022. So glad you could listen in. And as always during these Facebook Live broadcasts, if you have questions or want to give shout outs or comments, send them our way and we'll try our best to answer them. So today, looking forward to talking about all things audiology and hearing related issues. So I think you're going to find our conversation to be informative, and we have our audiology staff joining me today at CGH to answer some questions. So let's bring them up. Okay, so we have, let's get them all up. There they are. All right. The dream team, Dr. Laurie Zollinger, Dr. Jessica Birkey, and Andrea Brenner. Welcome.
Thank you.
Yeah, glad you could join me today. And just to give like a brief who you all are and everything. So Dr. Zollinger, Dr. Birkey, and Andrea, kind of just give me just a thumbnail about yourself and how long you've been here. And
all right. So I am Dr. Laurie Zollinger. I've been here at CGH and/or Sterling Rock Falls Clinic for 30 years now. So it's been quite a journey. I'm so excited about this next leg coming up with our team we have now. But it's been a pleasure working here all of these years.
Great.
And I'm Dr. Jessica Birkey. I just started about 2 months ago in June. I graduated from Illinois State University and I finished my externship at OSF, Illinois Neurological Institute in Peoria.
Okay, all right.
I am Andrea Brenner. I just started in February. I love working here. I kind of do whatever the audiologists need me to do, and then I do some phone calls and filing and whatever really comes up in the office during the day.
Yeah, you make things run smoothly, don't you, Andrea?
Yes, she does.
Good. We need those. We need folks to do that. That's great. Okay, so you all know who's. I'm going to ask some questions to our team, and I'll let you all kind of, I think you've already kind of figured out who's going to answer those questions. So let me just throw them out there, and then you all can answer the questions. Sound good?
Okay.
Ready to start? Okay. All right. First question is this. So a lot of people think of an audiologist as someone who kind of fits hearing aids. And while that's true, there is more to the story. So Laurie, can you kind of just lay out what else an audiologist does to help care for patients?
I sure can. So as audiologists, we perform, complete diagnostic hearing evaluations and vestibular evaluations. So this would encompass all age groups from newborns through geriatrics on a daily basis. So for instance, our newborns at CGH Medical Center and across the country are evaluated for significant hearing loss at birth. And if they happen to not pass the screening completed in the nursery, then they're sent to see Dr. Birkey or myself, and we do a more comprehensive type of hearing evaluation. This goes very smoothly when the baby is nice and sleepy. They don't have to be awake for the test at all. And we can determine estimated hearing being normal or not normal based on tests where they don't cooperate or need to cooperate. Next, for pediatrics, if we start with toddlers, we use play techniques to evaluate their hearing sensitivity. Often this is for kids who are having speech delays, maybe some middle ear fluid. They're seeing ENT, possibly going to get tubes or something along that line. We also consult with people with hearing loss and discuss things like noise exposure and trying to protect their hearing from noise-induced hearing loss issues. We also do hearing evaluations for the physicians when they have patients here in the office and they need a quick check of the hearing to proceed with the starting of their care. So pretty much in a given day, I could see a newborn, I could see someone 100 years old, it could be a hearing aid, a hearing test, a dizzy patient. We really get to do it all. It's pretty amazing here for us.
Yeah, that's a broad spectrum. So when you just mentioned the word dizzy, so when you're talking, you mentioned vestibular.
Mm-hmm.
You're talking for folks who have some sort of rotational type of.
Sometimes it's rotational, true vertigo type of dizziness or imbalance. Sometimes it's a little harder to describe. People will say it's a swimming sensation or a lightheaded or inability to walk straight. All of these things can be linked to inner ear problems. So inner ear is often where we start out. So our ENTs will see them, we'll do a diagnostic, and then the ENT will decide if they need to maybe have physical therapy for vestibular rehab, or perhaps they might need to go to neurology for a consult there.
Sure.
Sometimes it can just merely be age-related changes. As we get older, we do tend to lose our balance, and sometimes it's not something we can necessarily fix, but we can help them get the resources they need to prevent falls, broken hips, and things along that lines.
Yeah, good. So, and you kind of mentioned our ear, nose, and throat docs that you work with. Anything else to add in terms of how you work with our ENT docs to take care of patients?
Oh, yes. So on a daily basis, anytime there's an ENT professional in the office, Jessica or myself are available to do whatever types of evaluations they need. Usually it's a hearing evaluation. Oftentimes it's on a child who's having a speech and language delay or a history of middle ear infections, who's scheduled to have tubes inserted. We'll do a test before and after the tubes. Sometimes it's someone in the office who is coming in because they have ringing in their ear, or they're feeling imbalanced, or they've had a sudden change in hearing. A sudden change in hearing is always an emergency, truly, because certain types of sudden changes in the hearing, if it's treated very quickly within the first week or so, you have a much better opportunity to recover the hearing. So getting referred to the ENT department, contacting your primary care, let them know it's truly an emergency, and we can usually get them in to see the ENT rather quickly, who will then send them over to us for hearing tests. So it just smooths the process. You go from one room to another, and when you leave, you have your plan of action, because we all team up and we're available together to work hand in hand.
Great. And on a side note, speaking of appointments, I know I was talking to our new ear, nose, and throat doctor, Dr. Eunice, and I think he said that even for non-emergent things, I think the ability to get in is like within a week or so. So definitely have good availability to get folks into ENT these days.
Yes, ENT availability is very rapid still at this point in time. And for urgent things, when you're in the ENT office, they will send you our way for a hearing test. If you have a less urgent hearing matter and you're not needing to see the ear, nose, and throat doctor, there is a little bit of a wait time right now. We're pretty full and still trying to play catch up from being short-staffed for a while. So getting into ENT can be very quick right now. And if they think you need to see us, then you'll get in that same day that you're in with them.
Yeah, great. Good. Well, good information. Thanks, Laurie. I think we're let's get Jessica in here. Hey.
Okay. Hi.
Hi, Dr. Birkey. You ready for a couple questions?
Yes, absolutely.
All right. So let's talk a little bit about hearing aids, because that is obviously a big chunk of what y'all do. So why are they important, and when should someone consider getting hearing aids?
Absolutely. So hearing aids are such a crucial component to having better access to sound. In the same token, they provide sound awareness and sound localization, which is so important when we think about safety. We want to know where certain safety signals are coming from. If a car horn is coming, you want to know what direction it's coming from. If an alarm is going off, something like that, you want to be able to have that safety and sound awareness. They also can help to better understand in conversation when there's background noise, if there's multiple talkers on the telephone, if you're watching TV, they can help with that as well. A lot of people who have hearing loss struggle with tinnitus, which is ringing or buzzing or really any sort of internal sound. It can be caused by a lot of different things, but if it is from the hearing loss, then oftentimes it's our brain trying to give back the sound that we're missing. So it's creating that internal noise. And the hearing aids can oftentimes help with that to help make it less noticeable and less bothersome. I know for a lot of people, it can be very troublesome and really interfere with their day-to-day activities. Hearing aids have different masking features as well that can help with the tinnitus, where it plays a low-level sound in the background to help reduce your brain from focusing on that. Another thing is, anytime we provide someone with adequate access to sound, it's going to improve their self-confidence, their independence, and their overall quality of life, which is so important for anyone of any age to have those feelings. For your second question on when should someone obtain them, hearing aids should definitely be considered anytime there's any concerns for any of the situations that I mentioned previously. If you or a loved one feels like you're struggling or not hearing as well, or you just want to come in and get a baseline of your hearing so we can monitor it, then we would definitely recommend starting with that hearing evaluation. And then depending on what that says in terms of type, severity, and degree of hearing loss, we can guide you with other routes, whether that be medical intervention or amplification, and we can help you pick out what would be best for you.
Yeah. One of the things, as you say that, I remember like when I would see patients in the office, one of my selling points for people that were they were obviously having a little harder time hearing, or their family would tell me that, would be something along the lines of, hey, I really encourage you to do this because nothing makes you seem older, or there are very few things that make you seem older than if you can't hear a conversation going on. With your loved ones or with anybody. And it's, if I remember right, it seems like there's been some research lately that not only that, but if you don't hear well, it has an effect on your brain and your tendency to get dementia or those type of things. Can you talk a little bit about that too?
Yeah, absolutely. So there has been quite a bit of research, and especially more recently, that when we deprive our auditory system of sound for an extended period of time, that we can be more likely to experience things such as Alzheimer's, dementia, cognitive decline, things like that. So there has been a correlation seen when we're not taking care of our audiologic health.
Sure. And if I remember right, in terms of the when question of when to get hearing aids, can you speak a little bit to it seems like there is a sweet spot, because if you go a little bit too long and wait, when you put those things in your ear, is it harder to acclimate because you're all of a sudden you go from not hearing much at all to this, just oh my gosh, it seems like
right.
I can hear every cricket.
Right. So on average, most people wait about 7 years from the time that they realize there's a problem to actually getting help and moving forward with some amplification. And you're absolutely right. The longer you wait, the bigger adjustment it's going to be, gaining back all those sounds that you're missing. And just like you said, a lot of people have a hard time adjusting to the refrigerator running or a fan running, certain sounds in the background that we would normally just tell our brains to ignore. It can be a little bit harder as you continue with that hearing loss, but I wouldn't say there's a bad time to get them. You just, as soon as you notice there's a problem, we definitely want to get working on it and make sure we can get you better access to sound as soon as possible.
Yeah, good. Thank you. Another question that, I want to bring this up too. It's been out there in the news recently that I think it's starting in October. People are going to have the option to purchase hearing aids over the counter. In addition to the usual process of going to an office and seeing an audiologist to get fitted. Can you Dr. Birkey, can you just speak to some pros and cons of going the over-the-counter hearing aid route versus getting hearing aids through, someone like yourself or Dr. Zollinger here at CGH?
Yes, absolutely. So myself, Dr. Zollinger, and Andrea had actually done quite a bit of research on this when we saw it come out in the news. And from the research that we've done, the biggest pros to the over-the-counter hearing aids, I think, would be the cost. They would probably be a little more cost efficient for some people, as well as the accessibility. It's going to be something where you can just go in and take it off the shelf. Whereas with a prescription hearing aid, which is something that we as audiologists would offer, isn't something that you could get same day. It would take a while for it to come in. Cons for the over-the-counter hearing aids would be that you wouldn't have the support of a specially trained doctor of audiology or hearing healthcare provider. Those hearing aids from our research are made for a kind of standard, uniform, mild to moderate hearing loss. That doesn't necessarily meet everybody's hearing needs, and it's kind of preset. You can't adjust it to different types of hearing losses, different degrees and severity of hearing loss. It would just be that mild to moderate range, and a lot of people fall outside of that, or they wouldn't necessarily have the same configuration of hearing loss. The other downfall is that those hearing aids cannot be programmed by an audiologist or a hearing healthcare provider. So if there were to be any problems with them, any adjustments needed, the audiologists or offices wouldn't be able to make any programming changes because the software is so different that we don't have access to that. Another con, which would be a really big one, is that a hearing evaluation is not required to purchase one of these devices, which could bring up a whole list of other problems. You know, if that person's hearing loss is caused by a medical reason, we would definitely want to get that evaluated and potentially treated, where with over-the-counter hearing aids, we may not know, and it could just go unevaluated and lead to further problems.
Yeah.
In that same aspect, oh, I'm so sorry.
No, you're good. You're good.
Oh, okay. Sorry, I thought I interrupted you.
No.
In that same aspect, pros of, you know, seeing your audiologist or hearing healthcare provider for what we would call prescription hearing aids would be that we do have a wide range of modifications and acoustic features that we can change. We can modify programs, make very specific changes. We fit them specifically to that patient's hearing loss. It's going to be different at every single frequency. In addition to that, we can offer audiologic rehabilitation as well as monitoring of their hearing aid progress.
Let me stop
We
you.
also, oh, sorry, go ahead.
What's the rehabilitation thing? Can you talk about that?
Absolutely. So audiologic rehabilitation is, honestly, it encompasses so many things. Getting help, getting hearing aids, that's kind of the first step of rehabilitation. And then coming in routinely, seeing your audiologist, counseling, you know, working through problems, making different adjustments, talking about advocating for yourself and your hearing loss. Really, it's just the whole follow-up process after obtaining the hearing aids. It kind of starts with the hearing aids, and then the entire follow-up after that is where we provide the rehabilitation.
Okay, good. Great, thanks. I guess the next question I have is, and I don't know if you were going to try to answer this one or if Laurie was, but is like a hearing test, you know, like when you're going to get glasses, you go in there and Dr. Cutter goes, can you see this better or this better or this better, right? And eventually get a prescription that you could fill there or you could fill anywhere. Are hearing tests like that where you can get tell me a little more about that.
Yes and no. So a basic hearing test, you're going to come up with an audiogram that's going to tell what your sensitivity at each pitch or frequency is in both ears. So it gives you kind of a basic shape of your hearing loss. It gives you a basic picture of how well someone understands speech. So as far as a starting point for programming hearing aids, it does offer a really good starting point. But there's a whole lot more that goes into it besides the starting point. So a patient's needs as far as physically what will fit in their ear, what will be comfortable, what can they manage. One patient can manage pressing a button, adjusting a volume. Another patient might prefer to have an app on their phone where they can see what they're doing. Someone else might want it to be completely automatic. So the hearing test is kind of our starting point to see if a hearing aid could be helpful. but there's a lot more to it than just the hearing test.
Yeah, that makes sense. Okay. Yeah, thanks. I appreciate that.
Mm-hmm.
How about follow-up? I forget who was going to answer this question, but what kind of follow-up does your team provide for patients?
Okay, I think Andrea is going to take this question. She's been helping with a lot of follow-up with our patients in recent months.
Well, the greatest predictor of success with hearing aids is after fitting care. The fitting appointment is when the patient actually receives their hearing aids and they're set to the audiological parameters from the hearing evaluation. So from there, during the patient's first 6 weeks, we see them 2 more times. And then I actually call them at least 1 to 2 more times during that time so that we can make adjustments. When I call them that first week, I usually ask for any problems that they're having, any questions, anything I can help them with over the phone, and then relay that information to the doctors so that when they come in for their 2-week check, the doctors are prepared for the problems and can have ideas ready to go to help solve those problems. And we keep those hearing aid checks going throughout the duration of the care of the patient. So patients come in every 3 to 6 months on average, sometimes sooner depending on their needs, and sometimes mostly as average as 6 months. But they can call anytime during that time if they need to get in sooner or if they have a question. We also provide hearing aid drop-off service. So if they're having a problem with the hearing aid or because of dexterity, they need help changing the dome or the wax filter, we're able to do that. They can drop off their hearing aid, and most days we can get it back the very same day.
Okay.
So along with that, we can do some repairs inside. You can see in the office, you can see behind me all those drawers. Those are all, there we go. Those are all supplies that we have here in the office. So we can do some repairs here in the office. Sometimes we need to send it out to the company for repair. We always call the patient and let them know what's going on with their hearing aid when we do that. Another thing we do here is a lot of technology support with the hearing aids. Our hearing aids can do so many things. They have the app. They can count your steps. Some of the new ones now can keep track of your heart rate. They tell you how many hours you've worn them. If you use the app, you can, there's a part in there that's like you can raise the treble or lower the treble. It's kind of like the old equalizer on our stereos for people my age and, you know, that era. So I get a lot of calls for technology support with that. And since I am a hearing aid wearer, a lot of times they will ask me questions that I've had to solve for myself. So I'm able to understand, because sometimes it's hard to explain what they're having trouble with. But since I've experienced most of that, I can kind of surmise what they're saying and help them with that. We also do research for patients. We just had a patient who they were concerned that they wouldn't hear their smoke alarm because the smoke alarm is a high-pitched frequency and they don't hear those sounds. So I spent some time finding some products that have a lower frequency sound for their alarm and gave them all that information, gave them 3 or 4 options of things they could buy for that. So it's just nice to have somebody here. The doctors are so busy with seeing their patients. It's really nice for patients to have another person to be able to ask questions. And if I don't know the answer, you know, I usually let them know. I'll get back to them. I'll do some research. I'll talk to Dr. Zollinger or Dr. Birkey, and then decide. Oftentimes, somebody will call with a question. I'll refer to them, and they'll have me call them back and make an appointment for a hearing aid check, because maybe there's something else going on and it's not the hearing aid, and they want to check for that. So we're really available to them, Monday through Friday, 8 to noon, 1 to 5, whenever they have questions, or if they just want to drop off their hearing aid and have us clean and check it, that works too. So
Good.
lots of things we can do for them.
Yep. I'm gathering that. A lot of things. That's great. That's great. One last question. Any suggestions for getting back to this over-the-counter thing? Any suggestions for those who are trying to decide whether or not to go the over-the-counter hearing aid route versus seeing one of you all and getting set up for that and going through the usual process? Any like suggestions for folks?
I think the best suggestion that I have is to really ask your doctor for a referral to an audiologist for a comprehensive hearing evaluation.
Okay.
This is going to be covered by almost all insurance policies, Medicare, Medicaid, because that's really the starting point. We need to see if you need a hearing aid, or maybe if you need something else, like referral to the ear, nose, and throat doctor. Maybe you just have an ear full of earwax that needs to be cleaned out. It gives you a real starting point to see where you are and what you might need. I am so thankful to be working here because we really don't have, we're not here to sell you a hearing aid. We're here to help
Laurie
you
froze
with
for a
your
minute
hearing
there. I
loss.
bet you she's coming back.
Oh, I'm
There
coming
she
back.
is. There she is.
So
Start that again, Laurie, if you would.
okay, so I would definitely recommend coming in for a comprehensive hearing evaluation. You do have to have a referral from your primary care doctor in order to get scheduled for that, in order to have insurance cover it. But for most patients, almost all insurance, if referred by your physician, will cover the hearing evaluation. That gives us a comprehensive picture of your hearing loss needs. You may need a hearing aid, or you may need something else, like referral to an ear, nose, and throat specialist. You may need to have your ear cleaned out. But it gives us a good starting point, so we know if you have a medical issue or just a hearing loss that you need hearing aids for. And I want all of our patients to know and remember, we aren't here with the goal of selling you a hearing aid, a certain hearing aid. We're here to meet your hearing healthcare needs and get you the help you need. And it's based on what you need and want, cosmetically, cost-wise, accessibility-wise. So if we think the best thing for you is an over-the-counter hearing aid, we're not going to be afraid to say it. If we think the best thing for you is automatic, we can explain why. And if we think the best thing is for you to see an ear, nose, and throat doctor, we'll get you in to see them. So
Good.
I think starting with the comprehensive eval is really the way to go for everyone.
Yeah, good. Well, let's get everybody back on the screen. There they are. There's the team. Hey, thank you so much for taking the time to just answer some of these questions, and a very timely topic. Here's a question. Can COVID cause hearing problems, or loss, or tinnitus? What would you guys say about that?
I can start with this one. I would say absolutely. There are quite a few unknown side effects with COVID. I think we're still all learning so much about it. But we have seen some patients who have experienced changes in hearing or some tinnitus from COVID.
Good. Yes, I guess.
Even some dizzy patients, I believe, from COVID also.
Okay. Yeah. Good. Thanks for that question. Any other questions from the folks watching? Going once, going twice. Bueller. Hey, once again, ladies, thank you so much for taking the time to answer some of these questions, and appreciate all the work you do in our audiology department.
Thank you
very much
for having us.
Take care. Good. All right. Well, I wanted to just give a brief update. We always do a little bit of a COVID update, and I think we have some just our graphs that we would show you here. So this was the 19th of August. What do you have for the next one here? 26th, you see that we're still kind of in that high category. I think that's the last one we have, other than just the case averages. So we're just kind of just rumbling along at the same numbers, and we still have patients in the hospital that have COVID, definitely still ongoing. So yeah, it's still out there. You all know that. And I guess nothing's changed in terms of my recommendations is make sure if get fully vaccinated, be smart about certain situations, and otherwise enjoy your life and live it and enjoy it. The only piece of information that I noticed today that I thought I would just share, just to kind of, make sure that we understand this actually has been a pretty big deal, is that I just saw that the life expectancy this year is 76.1 in the U.S. And for frame of reference, before the pandemic started, it was around 79. So that's close to 3 years. And then my numbers may be a little bit off, but I remember hearing that if we cured cancer, that life expectancy would go up 2 or 3 years. So and there's a lot of people that pass away from cancer, obviously. So it gives you some sense of the reality of, the gravity, I guess, of this pandemic, if you will. And in 2020 and 2021, a lot of those deaths were related to COVID. Now, we're seeing also now an uptick of drug overdoses, liver disease, heart disease, also contributing to some of those deaths. And in some ways, it's kind of an aftermath, if you will, of the pandemic, and as that continues to go on. So, yeah, we're doing our best, aren't we? So thank you. Oh, and I have wanted to just put this out there too. We have started an urgent care for acute problems. So as an option for patients who maybe don't have the time, or whatever reason don't want to go down to Ready Care or see their primary care doctor, or it's not a fit to see their primary care doctor, we have this option now. And I think the thing that I want to make sure that you're aware of, that this is from 7 a.m. to 7:30 p.m., 7 days a week. So great opportunity, great option. And I encourage you, if you need that, to know that that's available and to use it. So yeah, I wanted to make sure we let people in on that too. So thank you for taking the time to listen. I did want to say that our next Facebook Live is, let me find my calendar here and make sure I don't butcher this. September 15th. Is that right? Let me see here. Yeah, it's September 15th. And we're going to have Dr. Al Saeed on. He's one of our oncologists, does excellent work. Looking forward to having him on and talk about some things related to cancer. So looking forward to having him. That'll be in a couple of weeks. Until then, thank you so much for taking the time, either now or at some other point in the future, of watching this broadcast. And I sure hope you have a great week, or 2 weeks until I see you again. Bye.